Hello guys, welcome to my YouTube channel Kineeds. So in this channel, you will get all the pharma related tips and tricks and how to study them. So let's begin with today's topic, that is Introduction to Pharmacology. Here we will study why do we need to study pharmacology and what are the things that pharmacology includes. So starting with what is pharmacology? So it deals with the study of drugs and their action. So, whenever we are taking a drug, what are the changes that drug does in our body in order to cure? Because we have a notion that whenever we are taking a drug, it is for the cure or the betterment of the patient. So these drugs, they go inside our body, alter some changes, and they are produce some benefit for the person. So what are the things that included? So origin, composition, therapeutic use, and most importantly the adverse effects are some of the things that are included. So pharmacology word has been derived from two words, that is pharmakon, which means drugs, and logos means to study. So combiningly we can say that it is a study of the drug. But what is a drug? So any substance that brings change in a biological function through its chemical action is said to be a drug. When a person is having any diseased condition, there is already some pathological changes in their body. Drug, after getting inside our body, they tries to bring back the body to the normal condition by showing some of the action, majorly depending upon what type of drug has been taken and what are the responses that we want. So this is what drug do. So these drug molecules can either act as agonist or as an antagonist. There are more, but majorly it is acting as agonist and antagonist. So there are receptors that are present on the surface of the tissues. So the drug molecules, they goes and combines with the receptor and they show a response. This response depends upon if it is showing agonistic activity or antagonistic activity. So if it is showing an agonistic activity, then there will be some enhancement or they will help and there will be the stimulation of a function. But if it is an antagonistic activity, then there will be inhibition. So what is agonist and antagonist? So whenever a substance or a drug is getting combined with the receptor and they are stimulating the central point and they are showing increase in the action, it is said to be agonist. So agonist is just like a friend, like a good friend. Whenever they are with you, they will help you to do something better or they will increase the productivity. So it is just like acting with the receptor and showing some good effect. But if we see in case of antagonist, they are also combining with the receptor, just like agonist, but they will not stimulate the central point. They will not produce something productive. Instead, they will shut down or they will inhibit the action. When we are going through the terms agonist and antagonist, there are two words which are very important, that is affinity and intrinsic activity. So what is affinity and what is intrinsic activity? So the drug is combining with the receptor. That means both drug and receptor, they have affinity for each other. They are liking each other. That is why they are combining with each other. So this is what we call having an affinity. When they are forming a complex or they are combining with each other, they are said to be having affinity for each other. And when after getting combined, they stimulate it and they are showing some positive effect or increase effect or they are stimulating the central point, it is said to have intrinsic activity. So agonists, they have both affinity and intrinsic activity, whereas in case of antagonist, the substance or the drug is binding to the receptors as usual, as seen in case of agonist also, which means that the substance and the receptor have affinity for each other. But in case of antagonist, they do not have intrinsic activity, which means they do not stimulate the central point. That again means that they are not producing anything productive. They are inhibiting the product. So agonist and antagonist, they have their own usefulness depending upon what are the actions or the end product we want. So the basic difference between agonist and antagonist is agonists have both affinity and intrinsic activity, whereas antagonists have affinity but they do not have intrinsic activity. Now coming to receptor. So what are receptors? So these are the macromolecules. They have a binding location or a binding site, and they are present on the surface of the cell tissues. And whenever the drug is taken, they go and they bind to their respective receptor. They show some conformational change and they will show its action. So the action can be agonist and it can be antagonist or any effect that we want. So whenever the drug after taking inside our body is showing the action, so the changes that the drug is bringing in our body is said to be pharmacodynamic process. And whenever the body in turn shows some action to the drug, it is said to be pharmacokinetic process. So we have already went through these two terms, that is drug affinity and drug efficacy. So affinity means when two substances comes together and they form a chemical bond or complex. This bond can either be weak or a strong bond, doesn't matter, but still they are bonding. So they are said to be having affinity. Just like drug and the receptor, they are combining together because they are having affinity. If they didn't have affinity, they would not have been combined. Then comes the efficacy. So whenever we are taking a drug, we have some intention. We want something from that drug. So whenever our desired product or desired effect has been shown by the particular drug, it is said the drug is said to be efficacious for us. So the ability of the drug to produce desired therapeutic effect is called as drug efficacy. Now, pharmacodynamics. So, whenever a drug does something to the body, we call it as pharmacodynamics. So, whenever drug is taken, it shows some effects inside the body. So, it can be anything, but majorly what it does, it either stimulates or it depresses or it produces some irritation. So stimulation means whenever there is a selective enhancement of the level of activity of a specialized cell or a specialized tissue, like some increasing effects. Like adrenaline stimulates heart, so they are stimulating it, they are not depressing it. It is producing additive thing. So this is the example of stimulation. Then comes depression. So like stimulation, depression can also occur. Similarly, when the drug combines to the receptor, it may show some depressing activity, like it will inhibit or they will minimize the effect or it will slow down some process. This is what we call depression. Then comes irritation. So irritation is not always selective. Most of the time they are non-selective and noxious effect. They are producing some kind of irritation in our body or in any organ. So another thing that comes under pharmacodynamics is enzyme. So we all know how enzymes are important for the chemical reactions to be done. So almost all the biological reactions are carried out under the influence of these enzymes. So enzymes are very important target for the drug action. So all the biological reactions are carried out by enzymes. This is why even for the drug action, enzymes are very important. So now enzyme inhibition. So enzyme inhibition can be of two types. It can either be competitive or it can be non-competitive. So in case of competitive, what happens is the drug and the enzyme, they have similar uh, structure. As a result, whenever there is a enzyme where a substrate has to go and combine, the drug starts competing with it. So it may happen that before the substrate, the drug goes and occupies the same site because they are structurally similar, of course. This is why that the resultant thing that was supposed to be by the combination of the substrate and the enzyme does not is not formed, and there is no product. So this is what it is done in case of competitive inhibition. Whereas in case of non-competitive, the drug does not necessarily have to go to the particular site and combine, but it can also combine to the adjacent site. So the drug goes and combines to the adjacent site. They make some changes in the receptor, and the catalytic site, it loses its property. As a result, again, no product is formed, or the desired effect which was supposed to be does not happen. So this is about enzyme inhibition in simple words. Then the drug receptor interaction. So when there is a drug and receptor interaction, there is some reaction that can be seen. This reaction can be any. It can be stimulative, it can be depressing activity. So depending upon if it is agonist and antagonist, which have we have seen earlier. So there is another point which is called partial agonist. So partial agonist are and partial antagonist, they are the same thing. Why? Because the drug goes and binds to the receptor. That means, again, it has affinity for the receptor. That is why they are going and binding to the receptor. But in this case, it will not stimulate the central point to its full potential. Like in case of agonist, we have seen it, the drug stimulates the central point to its full potential and show its effect, and there is an increase or enhancement of the action. Say likewise in antagonist, they go and bind to the receptor, but they completely inhibit the central point, so there is no action. But in case of partial agonist, although they go and bind, but the action is very partial. It is not full stimulation. Neither it is inhibited. It is somewhat in between. So we call it as it is having the partial intrinsic activity. Now, why it is also called partial antagonist? Because once the substance is going and combining to the receptor, it does not allow any other substance, any other enzyme or drug to again take that place. So it has occupied that place. So this is why it is also called as partial antagonist. So this was something about pharmacodynamics. So in the next videos, we will see what are the other things that are related to pharmacodynamics, pharmacokinetics, and all other topics.